Hello and good afternoon. I'm Sarah Hatch. I'm one of the social workers here at Sanders Brown, and we are so glad that you have chosen to join us today for our virtual dementia workshop. We ask that as we go through this programming, if you're able to keep your mics and your cameras turned off as we are recording this workshop, it just helps keep your privacy protected if your cameras are off. But as time comes for questions, if you want to turn your camera on at time for questions, that would be fine. We are excited that you are joining us today. We are excited. I want to introduce our speaker today, Emily Smith. She is a speech and language pathologist who currently works at UK's Cardinal Hill Outpatient Speech Clinic. And as part of her practice, she focuses on dementia care and working with families to help provide tools and education to help support them, those who have been diagnosed, and their family members. We are thankful that she could come and share some of her time with us today to talk about the importance of communication and how speech therapy can help. So welcome, Emily.
Thank you so much, Sarah. I'm really excited to be here today, and I appreciate the invitation to be here. So I'm going to talk today about how speech therapy can support a person with dementia through all the stages of dementia. And there are several benefits. Next slide. There are several benefits to, just like there's several benefits to early detection and diagnosis of dementia, there are benefits to early intervention, including speech therapy. And some of the benefits are working with a speech therapist may help to reduce anxiety and promote a peace of mind about your diagnosis and about your functioning. A lot of times people want to know, am I doing the right things? And it's good to have an outsider's view, a trained outsider's view to give you some feedback on that. When you have education and you have understanding about your diagnosis and your ability and your limitations, then you feel a sense of more control over your ability to make decisions about how you want to spend your time and what you need to do to support yourself. And speech therapy can help you to make those informed decisions, can help you make them, can help your family or your care partners make them. I can provide education and guidance about how to seek or provide care, decisions about how to support continuing to live as independently as possible, maybe support decisions about end of life and more, lots of other things. Speech therapy helps to promote healthy behaviors, including physical and cognitive engagement, nutritious diet, proactive safety measures for driving, medication adherence, home safety. The overall goal of speech therapy is to improve your quality of life or help improve the quality of life of those who are partnering with you in your care through education, training, and support. And the alternative to not having any intervention, and some people never see a speech therapist, but for some, if you don't get the intervention, then you might, I think I wrote, have an excess disability, meaning you would be less independent than you could be. A good speech therapist is going to recognize that not everyone with dementia experiences the same symptoms or has the same progression. And anytime you participate in therapy, in speech therapy, it should be designed for you, for your needs, for your abilities, and your goals. So all speech therapy, can you back up a slide, Sarah? Oh no, there it is. So all therapy plans begin with an initial assessment, which may sound a little overwhelming. There is a time and a place for a formal assessment or standardized testing, but there's also a time and a purpose for more functional or dynamic assessment. And your speech therapy assessment may include some of both. A speech therapy assessment will establish the current functioning or the baseline and needs by looking at the patient's or the person's with dementia's strengths and abilities, the patient's personal goals, the family or the caregiver's goals, and looking at any need for change or adaptation that would help increase your participation with communication or with your activities of daily living, increase independence, and increase safety. So next slide. Initial assessment helps us to set goals. Nope. There we go. Helps us to set goals for therapy, but the actual treatment will be delivered in one of these two approaches, either a direct approach or an indirect approach. Direct approach is one-on-one with the person with dementia or mild cognitive impairment. And that type of therapy typically occurs in earlier stages and in middle stages, some middle stages, when the person with dementia is still capable of new learning or training with a strategy. They can implement a strategy or a modification independently or with some setup support. And then caregiver family education training, eventually all of the therapy is going to shift from a direct approach to an indirect approach, working with families, caregivers, even caregivers in a residential facility. Speech therapists who work there can also do training and education. But that type of therapy is to help care partners to know how to support the person with dementia, support their quality of life and their independence. And that can be done in this outpatient setting. I can do that in session with all of us together, or I can do that separately with just the caregivers or the family. So hang on just a second. I'm going to get into the stages of dementia, but rather than going through each individual stage, I'm going to discuss the stages broadly because there's going to be overlap in the interventions. So I'm going to discuss how speech therapy can be beneficial in early stages, middle stages, and late stages. I know that there's considerable variability as to what each stage looks like for each person. So as I describe these stages, I'm speaking in very general kinds of terms. So next slide. One more. Cognitive changes in early stages, or changes that may appear in early stages, are changes with cognition and memory. And when I talk about cognition, I'm talking about thinking skills, including memory, but also attention, thought organization, planning, problem solving, reasoning, and more, orientation. People in early stages of dementia are still able to learn and implement strategies independently or with some setup assistance. And they need to rely on these strategies or supports like a calendar or a pill organizer or a to-do list, rather than just remembering, oh, I'll remember that. Nope, it's time to consistently use those memory supports. They may experience difficulty concentrating, planning ahead, making decisions, problem solving. They will often forget recently learned information and have some difficulty keeping the information correct. That's why the strategies are so important. The supports are so important. And as the early stage progresses, they will experience more cognitive and memory changes that require more support. Language and communication changes can include difficulty with word finding, that sensation of the word is on the tip of my tongue. I know what it is, but I can't think of it. Or difficulty organizing thoughts, to be able to explain or describe or to tell someone else instructions or sequence the steps of a task, but also having difficulty sequencing tasks themselves. What do I do first? Or I forgot that step of something. Difficulty sometimes following conversation, keeping the thread of it straight or keeping the topic straight, especially when tired, possibly also in a group. It might be too overwhelming to have too many people talking or the conversation bouncing back and forth between too many speakers. There can be mood and personality changes, including increased anxiety and anxiousness, possibly becoming withdrawn or losing interest in hobbies or social activities that they once enjoyed. Mood swings, depression, anxiety, and maybe the beginning of some sundowning. Day-to-day tasks, a person in early stages may still be living independently, working maybe, or volunteering in some capacity, may still be managing their home, their medications, their appointments with some supports or some reminders or modifications. Okay, next. So how can a speech therapist help in early stages? Well, I can provide a lot of education about the disease process, about the signs or the symptoms that you're experiencing, help you to develop a care team. And when I say care team, if you think of yourself as being in the center of a circle, and everyone on the circle is someone who is helping you to live your best life with dementia. That's what I mean by care team. And so helping you develop that team. Also education about community resources and some education of family or care partners, caregivers to help support the use, the implementation, and the consistent use of cognitive or communication strategies. A lot of times when I see people, the education components that we talk about, they will say things like, I wish my neurologist had told me this, or why didn't my doctor talk about this with me? And it's because your doctor is focused on managing your disease medically, and there just may not be time in the session to do that. But that's my role. That's what I can do. So hopefully your doctors will refer you to me. Also, speech therapy can provide some counseling, and we are not a substitute for a psychologist or a counselor, but we can play a role in helping you to cope and to plan for important conversations that you might need to have about driving or end of life, or the needs that you have in your home, or communication challenges. And then direct interventions, helping you develop tools and strategies and modifications for memory support. I've listed some there: calendars, journaling, note-taking, list-making. There's lots of different things we can do. That's one of my favorite things to do, is to help people troubleshoot what they might need so that they can continue to participate the best that they can, or participate independently. I also direct interventions of helping you to establish routines or schedules, helping you to identify what it is that makes you successful cognitively or with communication. And we might do some, at very early stages, some direct techniques to support memory or try to improve memory, like spaced retrieval or possibly computer-based training programs. Next slide. So considerations for early stages. Beginning with a speech therapist in early stages can help to maximize the benefits of therapy. And I would encourage you to go sooner than you think that you need a speech therapist, so that you can find a good speech therapist to have on your team, and so that you can be affirmed in the good habits that you already are engaged in, and the strategies and supports you're already using, and to help you establish more good habits and good supports. I want to talk here just a second about some tips for communication in early stages. And these will be tips for care partners or family. First thing, you always want to try to be as supportive as you can, maintaining trust in that relationship, empathy, and really listening well. Checking in on your own emotions so that you can be patient. I know this is a lot easier said than done, but really watching your tone of voice, watching even your own resources, making sure that you have enough energy to talk about the things that need to be talked about, or to help in the ways that you need help. I would encourage you to allow extra time for your loved one to process what they've heard and to form their response. And I would encourage you to consider the times that you have significant conversations. You want to do that when everyone has the mental and emotional capacity for that. So you might need to plan ahead a little bit about those conversations, and help your person to plan ahead. The next consideration is the person in early stages may not be informed about how therapy can help, or may be reluctant to admit that they need help. And it can be hard to accept this diagnosis, and hard to accept the reality of the impact of dementia on daily living. And rather than hiding from dementia, I would encourage you to face it and seek out every possible support you can, not just for today when you feel like you're doing okay, but to be prepared for the future as well. All right. Next, we're going to talk about middle stages. And I want to remind you that there is considerable variability in these stages. And in these middle stages, cognitive communication changes probably cannot be masked any longer. And the person with dementia may not be able to maintain their awareness of their changes and their awareness of their limitations. So more support is needed to manage daily tasks, including things like medication, finances, household tasks, meal prep. They may need assistance when they're in the community with shopping, with appointments, or with events. They may have difficulty remaining oriented to time, day, place, where are we, to themselves, and to what's going on, the task at hand or the tasks coming up. May have difficulty or be unable to recall information about themselves, including personal information or information about recent events. Communication changes can include more difficulty with word finding and possibly confusing words, saying the wrong word, or not understanding words, decreased speed of processing and comprehension of the information that they hear and see, difficulty initiating and maintaining conversations, changes with their ability to understand humor, may experience changes with their ability to read and write, and they may say or do things that are socially inappropriate. Mood and personality changes can include increased frustration, may start having some challenging behaviors, being physically or verbally aggressive, refusing to bathe, hiding items, being moody or withdrawn, especially when the social or the mental situation is much more demanding or much more challenging, may become suspicious of others or have delusions or compulsions, or exhibit repetitive behaviors like hand-wringing or shredding tissues, things like that. Day-to-day tasks are going to require more assistance with the sequence of ADLs as activities of daily living, like dressing, bathing, toileting. IADLs are independent activities of daily living, like cooking or hobbies or interests. They may need assistance ordering at a restaurant. They may have a tendency to wander or to pace when they're not really sure what to do or what's next. And there may be some changes in sleeping patterns, maybe getting days and nights confused. All right, next slide. So how can a speech therapist help in these middle stages? Again, education and counseling, definitely education and counseling that's tailored to your needs about your disease or about behavior management or the role of your family or your care partner. Direct interventions of training and implementing more visual, written, or verbal cues to support daily living, the sequence of dressing, bathing, toileting, supporting memory or orientation. I can advise and train on how to maybe modify environments for conversation and communication success, and address supporting social interaction and participation with others. I know that's all really pretty general stuff. I'm trying to think of some examples. I think examples in this would be memory books or memory boxes, that those can help support communication, and really talking to care partners about how to communicate best, which would be the next slide. In these middle stages, I hear more from caregivers and their need to troubleshoot different tasks or situations. Cognitive and communication skills are changing significantly and sometimes rapidly. And it's so important for the person with dementia to remain engaged in purposeful and meaningful tasks based on their ability, so that they continue to have a feeling of worth and of value despite these cognitive and communication changes and challenges that they are experiencing. Tips for communication. This might be a stage where the caregivers need to think about reality orientation versus validation. Sometimes it's important to reorient your loved one to the reality of what's going on, and sometimes it's okay to just validate feelings or validate what they are experiencing. In middle stages, caregivers might need to ask more direct questions, like yes, no questions, or giving choices instead of open-ended questions like, what do you want to eat? Or what would you like to do next? Make sure to gain your person's attention before speaking so that they know that you want to talk to them. Again, allow extra time for processing and for responding. As a care partner, it's challenging, but being patient, especially with repetitive questions or statements, avoid being critical. And I see sometimes in these middle stages, caregivers do a lot more testing, like, do you remember? Do you know her name? And that's not conversation. That's not communication. And it probably puts your loved one, makes your loved one a little more anxious on the spot. I don't remember. I don't know. So just remember as a care partner that communicate, it doesn't have to be perfect anymore. It's okay. It's okay. You can validate the difficulties that you're having or that they're having and apologize when necessary for communication failures. All right, late stages. Next slide. Okay, late stages characteristics. In late stages, a person living with dementia really is no longer able to live alone, to live independently. Cognitively, they may be able to recall some personal information, or that might happen occasionally that they can remember some personal information. There begins to be a significant loss of awareness of recent events and of their surroundings. Communication changes include changes and challenges with all modes of communication. So being able to verbally express, to write, to comprehend what they hear, and to comprehend what they read. A lot of difficulty expressing themselves, and maybe nonverbal in these later stages. Their speech may be unintelligible at times. They'll have difficulty following instructions, comprehending conversation, and may have lost their ability to read and write. Mood and personality changes may include depression or increase with behavior problems such as anger or suspiciousness. And daily tasks, they require 24-hour support and are dependent for care, and will also need assistance with hydration and nutrition. So how can a speech therapist help? Next slide. Again, education and counseling. This is going to be more with care partners, probably exclusively with caregivers. And it shifts to the type of education and counseling is going to be, yes, it's going to be about communication, but it tends to switch to more to swallowing ability and nutrition and hydration, some about behavior management. And the interventions I can help design meaningful and purposeful activities to decrease isolation, to things that you all can do together that might still interest the person with dementia. Advise on how to train or modify environments for conversation or communication success, and look at swallowing assessment and recommendations for safe swallowing strategies or changes in diet texture. All right, next, considerations. Therapy in these late stages is going to become more indirect. So it's really more with the care partners rather than with the person with dementia. And people in this stage, I touched on this a little bit before in middle stages, but I want to talk about it again because it's so important. People in every stage of dementia, even people who are nonverbal, remain aware of the connectedness that happens through communication and interaction. And in late stages, the person with dementia may not be able to actively participate with any activity or with communication, but they are still aware of their loved ones, of their caregivers interacting with them. They still understand tone of voice. They still understand the ways that they are touched, like holding hands or stroking their hair. and they are aware of how they're being interacted with. So really in these later stages, communication tips is all about maintaining the relationship through joint attention, through your tone of voice, through touch, through just being together instead of being, isolating or ignored in those later stages. So that's what I had today to talk about, how speech therapy can support through each stage of dementia, early, middle, and late stages, and some communication tips for each one of those stages. And so Sarah, if we have time for questions or conversation.
Yeah, we do have time for questions or conversations. So if anybody has questions they would like to ask Emily, feel free to put them in the chat, or you can unmute yourself and ask a question.
I have a question.
Yeah.
If I wanted to see a speech therapist, do I go through my primary care or do I go through neurology? How do I start that?
That's a great question. You will have to go through a doctor to get an order for speech therapy. Mm-hmm. And it's whoever you think you need to go to. Either one would be fine. It can be primary care doctor. It can be neurologist. Neurologists tend to maybe give the order a little bit faster. Mm-hmm. You might be seeing your neurologist more frequently than your primary care doctor. Mm-hmm. And it's your neurologist who gave you the diagnosis. So they are really kind of stand at the ready to give orders for speech therapy, for physical therapy or occupational therapy or dietitian or any other support like that you might need. It's a great question.
Okay, thank you.
If you are able to come to speech therapy, in our clinic, we have 45-minute sessions. Sometimes I can extend that time if I don't have anybody after your scheduled appointment. And I usually meet with people once or twice a week, depending on what they need. Your loved one is certainly welcome to come with you as far as I'm concerned. Sometimes that's best if they're able to come with you. Sometimes we may not want the care partner there. You might have things you want to talk about, and that's understandable too. So we can have some flexibility with that. But it's usually 45-minute sessions once or twice a week. And we usually go a month or more. Sometimes I'll usually say, let's give it a month and then see what else we need to do. I've seen some people for 3 or 4 months. It just depends on what they need and what we're able to do together.
Okay, thank you.
I wanted to make a comment.
Yeah.
I'm a caregiver for my 97-year-old mother, and I'm in year 7 of 24/7 care. I just went, It's been a journey, and I've learned a lot.
Yeah.
And part of it has been about where I, as a caregiver, can best provide focus and for helping my mother. And what I've learned over the course of these 7 years is there's 2 types of therapists that have been the most helpful. One is the occupational therapist, and the second is speech therapist. I had no concept of the depth and breadth of what speech therapy covered. I mean, just for general populations, but especially for those with dementia. And the thing that I've seen that's been most important about getting this type of therapy and remaining engaged with therapists long-term for my mother is it's these 2 groups that help bring joy into her life. And as a caregiver, that's immense. It's immense because it's about communicating. And it's about connecting with others. That's what these therapists are helping her do. So I just wanted to, throw that out there as a, go for speech therapists, because it's been really important for us, both for her and for myself as a caregiver. Thank you.
Thank you for saying that. I appreciate that. And that's really what I want to do. I want to make your life as a person with this diagnosis, your life as a caregiver, care partner, the best it can be. The best it can be. And since you mentioned occupational therapy, I want to say a little bit about what occupational therapy does so that people know. There is a little bit of overlap between speech therapy and occupational therapy in terms of addressing some cognition, memory supports and sequencing of tasks. But occupational therapists work a lot on activities of daily living, dressing, bathing, toileting, shaving, toothbrushing, those kinds of cooking, driving, even those kinds of things. And they also help work on fine motor skills, hand skills, or upper body with arms and shoulders. So they can help to find things that support independence, activities to engage in, and they can also help work on positioning. So positioning in a wheelchair, positioning in bed, helping to train you on how to transfer your loved one, from bed to wheelchair or wheelchair to toilet or whatever it might be. So yeah, OTs can do a lot as well.
Hi, this is Judy Miller.
Hi, Judy.
Hi. So I've been having trouble with words now for, I think it started about 6 months ago, and it's gotten progressively worse.
Okay.
And I'm hoping I can keep talking to you and I don't have to walk around the mulberry bush to find out So, but now it's getting worse. And also, just as I took notes here, and thank you for all because I've been in speech therapy, different times, and I have to laugh because the first time I said, I don't lisp, I don't do, why would I go there? And it's just amazing what they do. So I've gone 4 different times, and now it's gotten to a point where, my not only my ability to come up with all the words I need, but also writing. And, as I took notes, I had trouble writing some of them down. And so I'm, going into that whole situation. So I'm going into I'm starting again into speech therapy. And now that I realize how serious this is, and it's not going to go away, and it's going to get worse, and it's going to, how do you find a good therapist? Because listening to you, I want to, move to where Rita lives, drive back and forth or whatever.
Right.
Yeah. So how do you find someone? Because I have had, when I first went into it, they thought I was just, everything's fine, you're good, without my knowing. And then the other one, it was just not, yeah. So what do you look for? And if that's possible?
I think that's a great question, Judy. I appreciate that. So when I talked about developing a care team, that one of the reasons that you want to start with speech therapy sooner rather than later is it may take time to find the speech therapist you want on your team. It may take time to find the OT you want on your team. It may take time to find the PT you want on your team. Every therapist, yes, we all have the same training to a large extent, but we all have areas of interest. We all have personal experiences or have done additional training to learn a little bit more. So the first thing I would ask is I would ask your referring doctor if your doctor knows a good speech therapist or someone that she or he often refers to, maybe a clinic that has a memory care program, or if they know of a speech therapist who specializes in working with people with your diagnosis. That would be one thing to do. So ask your doctor if they know of someone good or where they typically refer. The second thing is when making the appointment, If you can speak to the therapist before you begin, or if you can speak to someone in the office who is scheduling you, to make sure that this speech therapist has experience and knowledge in working with someone with your particular diagnosis. That would be two good things to do. And then, if you got a good recommendation, and yes, she does work with people with your diagnosis, and you show up and it's still not what you're expecting or what you're wanting, it is necessary. It is important for you to advocate for yourself and say, this isn't quite what I expected, or this isn't quite what I needed. This is what I want. This is what I need. This is how I want to get better. And just have an honest conversation with your speech therapist. And if she can't help you get there or doesn't seem to get it, it's okay to part ways, to say, I don't want to do this anymore, and then try to find someone else. Ask your community too. Ask in support group. Ask Sarah and Kelly. Ask anyone you work with and see if they know of a good speech therapist or a good occupational therapist. Great question.
Well, thank you so much. This has been amazing.
So, Emily, speaking of good speech therapists, what office are you out of?
Oh,
so that I can make recommendations.
Okay. Well, I work for UK, and I'm in an outpatient therapy clinic at Cardinal Hill. So we are at the back of the building. So if Cardinal Hill faces Versailles Road, we are at the back of the building at entrance E, as in Emily. Okay. So that's where we are.
All right. Is there anyone in the Ashland area that you would recommend? I mean, I do a support group in like the Boyd County, Ashland area. Is there anyone that you would recommend out this way if they can't get out your way?
No one that I know of. We can do televisits. Well, let me qualify that just a little bit. Depending on your insurance, sometimes insurance will allow that. Sometimes they won't. I know that with the federal government extended televisits with Medicare, so we can do that now. I would absolutely prefer you to be in person.
Yeah, for sure.
For evaluation and even treatment if possible, but sometimes that's not possible.
Yeah.
And so I can do some telehealth as well. But no, I don't know of anyone in the Ashland area. Sorry.
That's okay. That's okay. At least it gives me some base to give them some ideas. So thank you for this.
Yeah. Mm-hmm. Anyone else?
Yes, it's Judy again. Do you have any, seeing that I'm moving ahead faster than I want to, is there anyone you would recommend in Lexington? No, the other, Louisville?
Anyone in Louisville?
Yeah.
Oh goodness, I think there are several. I'd have to look that up and let you know.
Yeah,
I can try to do that, and I can try to do that for Ashland as well.
Awesome, thank you.
Okay. Yeah, I can do that. That also, I appreciate you both saying that, because as I go to my state convention in February, it will help me to kind of network a little bit better too.
Hi.
Yeah.
I have a question on communication. My husband with Alzheimer's is probably mid-stage, and communication is, he asks questions all the time. And do you have any techniques or suggestions? I answer the questions, and I've written down the answers to help with that. But is there any other way that you would suggest?
Well, I think you've done two really good things, answering the questions, and you've written it down. Does he refer back to what you've written down? Or can you direct him back to that?
He does. I do have a whiteboard that, for the calendar. What are we going to do next? What are we going to do next? He's always interested in what's going to happen next. Mm-hmm. So I do direct him to that, but it seems over and over.
I know. That's really challenging. those would be the first two things I would suggest to you is
Okay.
to have that written down. Does he help you plan the schedule for the day?
No, he just asked me, what's up? What are we going to do today?
And can he help plan, or can he participate in some way with that?
Possibly. I mean, he keeps asking about a family reunion, and we've traveled up to Pennsylvania 3 times this year, and he has no short-term memory, so he doesn't remember. But it's like, that's on his mind. He goes, when's the next family reunion? When's the next family reunion?
Did you on the reunions or the trips that you did, were you able to create any kind of a memory book for him?
Not so much a memory book. I was writing down what we were doing each day, but maybe some pictures that we've had.
Yeah, that might be good with like pictures and written information that even includes a page of like our next family reunion will be. And if you know the specific time, you could put that in there, or in a few months, if you need to be a little more vague about it, or after Christmas, or, something like that. So maybe a memory book might help him. He might really enjoy looking back at those pictures, and pictures labeled with the people in the pictures, or statements about what you did while you were there, or what people are, what's happening in their lives. That might help scratch that itch, so to speak, or satisfy that inquiry. If he can help you plan the day, maybe that's part of it. He wants to be purposeful, and I understand what you're saying. He probably can't walk up and say, today I want to do these things. But if you had a few things listed today we need to do these 4 things. Which one do you want to do first? Or which one do you think we should do this morning?
Okay.
And maybe engage him in that way. And then when he's asking, what do we do next? You could even, I'm sure, and you direct him to the calendar. Well, go check the calendar and see, or check our schedule for today and see. It's on the schedule board.
Okay. Well, thank you very much.
I know that's may not be a silver bullet, but it sounds like you're doing good things, doing the right things.
Thank you.
All right. Well, we are almost at time. So I just want to say again, Emily, thank you so much for sharing this information and these tips. Emily has shared her slides with me, so I will be emailing those out along with a link to this recorded presentation. It may take a little time, so it may not happen today, but in the next couple of days, early next week, hopefully, I can get it emailed out to you with the PowerPoint and a link to the video. And if you get some suggestions of speech therapists across the state, send it my way, and I can include it with the email. And it's always a great resource to have as we work with lots of families as well. So again, thank you so much. Emily, are you okay if I share your contact information, or?
Yeah, sure. Yeah.
Just the clinic's information?
My name. Well, you can do my name and the clinic phone number.
Okay.
That would be good.
That way people have a way to connect if need be. I will do that. Well, we thank you all so much for joining us today. Our next workshop, the virtual dementia workshop, will be in February, and we will be talking about Medicaid waivers and have people from the Area Agency on Aging who manage those waivers here to kind of describe that process, what it is, how it works, and all of those things. So I'll be getting a flyer out soon, and registration will be up here in the next couple of weeks. So
right. Thank you so much, Sarah. Thank you, everyone.
Great day. Try to stay dry.
Yes, thank you so much.
You're welcome. You're welcome.